Hello, everyone, and welcome to Wine and Wellness Wednesday. I'm Lindsay Brantley, the founder of Camellia Alise and the Camellia Alise Academy, and I'm super excited to have each and every one of you guys here with us this evening. So, as it is traditional for us, I first want to toast to each and every one of you for making it through that halfway point of the week. So if you have your glass of wine, toast with me. Like I said, I want to toast to you guys. Happy Wednesday. All right. So I'm super excited to have each and every one of you guys here with us today. Thank you so much, everybody that's joining us live. I'm going to talk to you guys about an issue that is very near and dear to my heart. And I really want you guys to just kind of ask me questions about it. But September is Pcos Awareness Month. And if you know me, or if you've ever been to my spa, you guys see that we have teal everything, okay? We even have a teal Keurig, okay? Everything in here is teal. Those are our brand colors. It's my favorite color. But in addition to it, teal is the national color for PCOS. Since September is Pcos Awareness Month, I kind of wanted to tell you guys a little bit about PCOS. But before I do that, once again, I want to welcome you guys. It is Wine and Wellness Wednesday. We do it every Wednesday. So I hope you guys have your glasses and are tuning in with us. And on Wine and Wellness Wednesday, we talk about self-care, skincare, and everything in between. So today's topic is going to be PCOS awareness. Like I was saying before, September is PCOS Awareness Month. And for those of you guys who don't know, I started this skincare journey because of PCOS. I have PCOS, and that stands for Polycystic Ovarian syndrome, okay? So it is a hormonal, metabolic, and genetic syndrome that 1 in 10 women in the U.S. of childbearing age have, okay? And a lot of people don't know that they have it. I think they said only maybe half of the people that actually have it are diagnosed with it. There's a lot of people who have PCOS and they don't realize it. So the most common condition, and the reason that it's kind of caught more often, is irregular cycles, right? So for me, I was that girl that was at 16 years old. I would have a cycle in 1 month, and then none the next month, and then none the next month. I would have one every 3 months, every 6 months. So we caught it pretty early. I have a very severe case of it. But for a lot of people that don't necessarily have that symptom, some of the other symptoms for PCOS would be a lot of facial hair or facial or regular body overgrowth. So if you normally notice that, you know, I have more facial hair than others, which is why I started our skincare company. I'll get into that in a second. But facial hair, sometimes severe acne can be a cause of it. Also, I'm trying to think. Well, obviously they catch it because they find small cysts in your ovaries. That can be, that's definitely a sign that you have PCOS. Insulin resistance is part of it. And then anxiety and depression, male pattern baldness. So you start losing your hair really young. You might be thinking, okay, what's wrong with me? That could be one of the hormonal causes of PCOS, one of the symptoms. Anxiety and depression as well. So a lot of people don't realize it, which of course right now in the wake of COVID, it's hard to say that anxiety and depression is a reason to get tested for PCOS, because everybody has anxiety right now, right? But I started this business because I have PCOS. I learned that I had it very young, like I was saying. And I have the facial hair issue. It's called hirsutism. So that's an excessive growth of hair on your face or body. And I noticed it very early. And what happens, like I still bear a couple of the scars from it. But what happens is people, you know, shave, they pluck, and then they wind up scarring their faces, scarring their body because they're always trying to get rid of it. So I developed the skincare products to help solve that issue so that people who were, you know, shaving and waxing a whole lot wouldn't experience the irritation that comes along with it. But we got one really good question I'm going to answer for you guys. And it says, what were some of the symptoms that you experienced that led you to get tested? So for me, one of the things that people notice, first of all, is going to be the irregular cycle. So if you have, you know, a cycle that is just so irregular, it's not on 30 days, it's not on 60 days. You know, there are many times, guys, I get 2 cycles a year. So I'll get a cycle every 6 months. That's not normal, right? So you go to your doctor, they'll test you for that. Or like I said, if you notice that you have excessive hair growing, that's one of the things that, you know, kind of a lot of people are like, wait, why am I growing all this hair on my face? Let me get it checked out. A lot of women are diagnosed with it because they have fertility issues. A lot of people don't have any other symptoms until they're trying to have a baby, they can't have a baby, and their doctors do blood work to figure out, hey, what's going on? And as part of that, they wind up seeing, hey, you have cysts in your ovaries, and that is how most people who have PCOS find out that they have it. For me, it was simply the hair and the irregular cycles, and so my doctors tested me for it very early. 50% of the people that have it don't get diagnosed with it. Like I said, unless you have fertility issues or cycles, something that signals your doctors to test for it, a lot of times they won't just check your ovaries. And also, I will say that half of the people, 50% of the people who have PCOS wind up having type 2 diabetes or become pre-diabetic before they turn 40. Now for me, I became pre-diabetic very, very early, and I had gestational diabetes. So that means when I was pregnant, I had diabetes symptoms. I had to be very careful with my sugar levels. So that's something that can come along with PCOS. Is it hereditary? Yes, it can be. It is one of the genetic disorders. And then a question that came up is, have you had cysts removed? Well, I guess fortunately for me, I have not had to have my cysts removed. My cysts have been a controllable size. I've had a lot of them, guys. I've had where, you know, they've done ultrasounds, and I've had a lot of them in my cysts, but none of them have ever ruptured, and none of them were ever big enough for my doctor to remove them. So I didn't have to, but I did have a lot of fertility issues. So when I was ready to have a baby, you know, somebody that has a cycle once every 6 months, it's like, okay, how are you going to get pregnant if you're never having a cycle? So I had to do shots, I had to do pills, I had to do lots of injections. I mean, so it took a lot for me to get pregnant, but you know, I was very blessed. I do have a 7-year-old son now, and thinking about a next one, so it'll go through the whole process all over again. So it is a challenge. I do want to point out a couple things. One is I'm wearing my shirt. This time last year, the Camellia Alise Studios was the hosting space for PCOS Challenge. PCOS Challenge is the National Polycystic Ovarian nonprofit organization, and I'm wearing my shirt today. I'm super excited. Camellia Alise is an official sponsor of PCOS Challenge. Every year in September, they do a 5K run walk. Last year, like I said, they did one here in Houston. This year it's going to be in Philadelphia. So they are, even though, you know, COVID is out, what they do is they space you out. Everybody walks and runs at their own pace. So they are doing it September 25th through the 27th. I was just super excited to be able to host them here last year. So we did host it here. We are official sponsor of that organization. 1% of our sales goes to PCOS Challenge at the end of the year, every year. So when you're supporting Camellia Alise, you are supporting PCOS research as well. And then a couple other questions we got. I love that you guys are asking questions because, like I said, this is a syndrome that is very near and dear to my heart, and I've been fighting, you know, the symptoms of PCOS since I was a teenager. Another question, we got a couple questions. What is the treatment for PCOS, and is there a cure? So I will tell you that there is no known cure at the moment. There are different things that you can do to control the symptoms, and if you have been on the Camellia Alise page, I just recently posted, if you guys see the girl that's shaving her face, that, you know, unfortunately, that was me. But some of the things that they recommend first to control it is eating a balanced diet. Right now, there's a really big movement going, and I haven't jumped quite into it yet, but I'm noticing a lot of my PCOS divas, my PCOS sisters that are doing the keto diet, and it seems to be helping some of them to reverse the effects. because we are insulin resistant, we're very sensitive to sugar. So taking out some of those carbs and some of the breads and things that produce sugar in your body have seemed to be able to help them to keep some of their symptoms under control. Another one is going to be dairy. A lot of people don't like to get rid of dairy, but I counsel a lot of my clients on even with acne, having issues. You definitely need to kind of ditch the dairy. Green tea helps a lot, and regularly exercising. Unfortunately for us with PCOS, we have a lot of weight gain issues. We just do. That's part of it. So moving around, exercise, physical exercise helps a lot. And I also just posted, we posted today some of the best exercises for you to do if you have PCOS. Swimming is great, walking is great, running is great, which is of course why they do the 5K walk and run. So those are some of the things that you can do to kind of help. But like I said, there's no cure. When it comes to controlling the symptoms, you can do natural things like I'm telling you, watching your diet, working out. But when it comes to pregnancy, things and controlling acne, things of that sort, you may have to do fertility treatments. So there's a lot that comes along with it. How long did it take you to successfully get pregnant? So I guess I'm a little bit more fortunate than others. I had a doctor who was very aggressive and was very, very familiar with PCOS. So it took about 18 months of trial and error, okay? But I had a doctor who put me on Clomid, because that's like normally the first fertility drug they give you. They put me on Clomid. After about 2 months, they're regularly checking me. Okay, you're not ovulating with it. It's not helping to reduce your cyst. So we're gonna stop. We're gonna try something else. So I had a doctor who was very efficient in trying new things and not, taking a lot of time. So it only took about 18 months. I didn't have to do IVF, so that worked out for me. It took me 18 months, but I was very, very strict on my diet. And I had a doctor that was quick with trial and error. He's like, hey, if I'm putting you on something and I don't see any changes in, 2 months or so, we're gonna try something else. And so like I said, for me to get pregnant, I wound up having to do pills to stimulate my cycle. I wound up having to do injections to stimulate my cycle. I wound up having to do the shot to help release the egg. I had to do a lot, but it did only take about 18 months for me to get pregnant. So I know a lot of people that it's taken longer, and I will say PCOS many times is coupled with some of the other syndromes, and that becomes a problem as well. So if you have like PCOS and fibroids, or PCOS and endometriosis, like if you have a combination, it becomes the perfect storm, and it makes it a lot harder for people to overcome the symptoms. For me, I only had PCOS. I didn't have endometriosis or fibroids or any of the other complications. So once we were able to get my cycle into a regular rhythm, I was able to get pregnant pretty quickly. So I was blessed with that, but it still didn't stop. Like to this day, I'm not on any, birth control. I'm not on any hormones or anything like that. And so I still have the hair issues. Laser hair removal never worked for me. The only thing I think that worked for me were some of the creams. But when you're trying to get pregnant, you don't want to use too many of the creams because they can endanger your baby. So then the hair starts growing back. It just became, a vicious cycle. And so for me, I was like, I created products so that if someone needs to shave daily, they need to wax daily, they won't have all of the irritation that comes along with it. So that's kind of been my journey. And I'm always excited to answer questions and let people know that there's no one set cure that's going to fix it. Controlling my diet, walking has helped. And you guys you always see me drinking wine, right? It's Wine and Wellness Wednesday. So I'm going to drink wine, but I'm actually, in honor of PCOS month, I am ending my month with a 25-day challenge. So starting next Wednesday, guys, because I'm starting on the 25th, starting next Wednesday, I will be toasting y'all with water or Sprite or something else, because I'm going to stop alcohol for 25 days, increase my water intake, increase my exercising, and I've got to go back to my doctor, and we're gonna do another hormonal workup. So we'll see what happens. Okay, so another question. Since some of the symptoms could mean other issues, how long did it take for an accurate diagnosis? I will tell you, it is pretty easy to diagnose. First of all, if they do an ultrasound and you have cysts in your ovaries, then they know right away that you have PCOS. That's one. For me, another symptom when they're testing your levels, one of the things that they look for and utilize to diagnose it is elevated testosterone levels, which is also what causes the hair to either grow or for you to lose the hair. So for me, that was definitely one of the things that they were able to key in on and say, okay, testosterone levels are out. We're going to do an they're above normal. Do an ultrasound. We notice that too. All right, you've got it. So it's not, nowadays people know what PCOS is, so it's not very hard to diagnose it and to try to start getting things under control. A lot of times they give you metformin to kind of slow down the insulin resistance, and for some people that can put you back into a normal rhythm as well. But it does take trial and error. Everyone's body is different. So I just really encourage you guys, like I said, we're almost at the end of September, and so if you feel like you may have some of the symptoms of PCOS, ask your doctor to run the exam. All it is a couple extra blood tests or an ultrasound, and they can tell you. So if you feel like, this is something that may be affecting you, definitely get tested for it. And like I said, if it's skincare related, you have issues around it, that's very easy to fix as well. We have products that will help you to make sure that you're able to get rid of the hair without all of the bumps, without irritation. Loving your new hair color. Thank you guys for noticing. I figured fall's coming, I wanted to do something different, so thank you very much for that. If anyone else has questions on PCOS, I can definitely answer those questions. I can answer them here, I can answer them through DM, and then also check out PCOS Challenge, guys. Like literally, it's on my chest. At PCOS Challenge is an amazing, when I say an amazing resource for information. They have scholarships for people who have like the facial hair. They have issues with that. They have scholarships to help you get laser hair removal. They have scholarships for people who need help with IVF. There are so many resources that they have that you guys can look at to find information on PCOS and on ways to cure it. They even have a network with different doctors. Like here in Houston, there are fertility doctors, and there are doctors that specialize in PCOS. So it's very easy to go onto their website, search different, like I said, different skincare products, different laser places that they recommend, different doctors. So I definitely say check out at PCOS Challenge. They have a lot of resources to help you as well. So once again, I kind of wanted to just toast each and every one of you. Thank you so much for joining me today. Like I said, it is a very big thing as far as our self-care to make sure that our health is intact, especially now. So it's super important that if you feel like, something is off in your body, or you see something externally or internally that, you're just not feeling like yourself, go to your doctor, ask the questions. Like I said, I'm specifically targeting PCOS because this month is PCOS month, but in general, your self-care is super, super important. So is your skincare. So next week, I'm going to come back and talk about skincare, and I'm going to be doing a Q&A on skincare. So if you guys have questions about specific skincare issues that you want me to address next week, just make sure that you send me a DM, and we will get those things ready to go. I'll be answering your questions live, and then I'll also be answering the questions that you guys sent me ahead of time. Thank you so much for joining. Once again, I want to toast each and every one of you. Have an amazing, amazing Wednesday, and I will see you guys next week back here so that we can discuss more self-care and skincare. And if you are on the business side of things and you have any questions about marketing and business stuff, please tune in at 7:30 to the Camellia Academy, where we're going to discuss business things as well. Hi, thank you guys so much for joining us, and thank you guys for all the questions. If you have more, please DM me. Feel free. I will always answer them for you. Y'all have